Well, good evening, alumni of the University of Michigan. It's so great to be with you this evening. My name is Steve Grafton, and I am President and CEO of the Alumni Association of the University of Michigan. Really pleased to be with you, and pleased that so many of you have joined us for this important conversation with a university leader who is an expert in some of the issues around that we are all facing today, and we're going to learn a lot about that. And I'm happy now to introduce this person for all of you. Dr. Preeti Malani is the university's chief health officer and also a professor of medicine in the Division of Infectious Diseases at the university's medical center. As the chief health officer, she advises the university's president on a number of matters of health and wellness for the university community, including disease management, public health preparedness, and promotion of healthy practices on all three of the university's campuses. Dr. Malani's undergraduate degree is, and I'm very happy to say this, from the University of Michigan, LSA, where she received a communications undergraduate degree, and then went on to Northwestern and received a master's in journalism from the Medill School of Journalism there at Northwestern. Came back and then went and completed her medical degree at Wayne State University before coming back for her residency and fellowship at the University of Michigan. And while she was completing her residency in internal medicine and fellowship in infectious diseases, she also received a master's in clinical research design and statistical analysis. I'm tired just saying all of this, Dr. Malani. This is you've done some amazing work, and so it's no wonder that you know a lot about the issues that we're going to talk. In fact, I know that your research interest and clinical and research interest include infection control and prevention and infections in older adults, which I'm sure came in handy during some of the issues that we're dealing with now. Dr. Malani is also the director of the recently launched National Poll on Healthy Aging, based at the Institute for Health Policy and Innovation. And she's the associate editor of the Journal of the American Medical Association. Now, what I'm happiest about is that Dr. Malani is a great friend of the Alumni Association, and she has provided invaluable advice and guidance to us as we've tried to manage our own way through this pandemic in terms of engaging alumni, specifically and most particularly around the issue of the reopening of our Camp Michigania, where she's just been extremely helpful in our thinking about how to do that. So also, since the beginning of the pandemic, every week, Dr. Malani joins President Schlissel, and they provide updates to the university community about the pandemic, providing insights and guidance in our ever-evolving health landscape. So I'm just thrilled to be able to be a part of this evening and to have a chance to talk with Dr. Malani. And so let me welcome Dr. Preeti Malani.
Thank you, Steve. It's a pleasure to be here.
Well, it's great to have you with us, and I've been looking forward to this. And because some members of my family who are Michigan graduates, my sons said they saw the announcement about this and they signed up, and they said, "We can't wait, Dad. Finally, you're doing something we like." So I'm really
high
happy.
Praise, like high
that's
praise
right, coming from
your kids.
And I've talked a little, so therefore, about my personal. I wonder if we might just start with a little bit of personal information. I'm always love to ask alumni, how did you come to Michigan? You know, when you had a choice, I'm sure, to go plenty of places, and you chose Michigan. How did that come about for you?
You know, I'm very, very fortunate to have gone to Michigan, and I was, born and raised in this great state. My parents moved here in 1968, actually, after my dad finished graduate school in New York. And, I grew up watching the Maize and Blue, and I was fortunate enough to come here. And I think in a lot of ways, that time being here really prepared me for what I do now, which is, again, as you mentioned, the chief health officer. And, I'm actually also a current Michigan parent, and my husband, Mark, is also an alum. So, we're definitely a Go Blue house. We got one more at home. We're sort of lobbying her pretty hard, but we'll see where she goes. It's interesting that for me, being a Michigan graduate is really what I believe really set me up for success.
Yeah.
Because what I learned here really went way beyond the classroom. And frankly, I think I struggled a fair amount in my classes, but I figured out. I became very resourceful. I figured out how to pick myself up, how to become resilient. I also learned the importance of community. I met so many different people. I just have such fond memories of playing euchre in Mosher Jordan, of,
Mhm.
just we won the NCAA championship when I was a student here at basketball.
Mhm.
And, I also learned the power of my voice, how to not take no for an answer. And for me, I'm fortunate enough to still be here on campus. And when I walk around, I still feel like I'm 18 years old and that I can do anything.
Well, I think that's great. And for those alumni that are on that are parents, I've been thinking about visiting with you and how impressive you are and how much I have a granddaughter I just spent some time with this weekend, and I'm always thinking about how to instill in her this notion that she can do, like you said, whatever she wants, and she can be successful. And I appreciate that you say Michigan got it there, but I know you've done this on your own. You really have achieved a lot. And I just wonder if you might have some advice for parents who are thinking about how to guide their children toward college, and from your own success.
Yeah, it's funny. And again, we've done it once and we're about to do it a second time. And I'd say the first one was quite successful. Our son Nicholas is finished his third year in College of Engineering. And, it wasn't obvious where he should go and where he should be, but he's really found a great home at Michigan and academic success and social success here. But, I think one thing I will say is that college is really different than when we went to school. And I think honoring that difference is important and letting the students sort of have their experience, their version of Michigan, but also, relishing in the fact that they do have some of the same experiences that you do. But, again, I think these kids are pretty smart and they're certainly far ahead of what we were. It was a sort of different system. But I would just say be patient, it works out.
Well, I appreciate that. And do I understand too that you were in school at the same time as Sanjay Gupta?
Yeah, I was. And in fact, Sanjay and I, our families knew each other from when we were young, and we grew up together. And we were undergraduates together, and then we were residents together, and we have remained good friends.
Well, you both have made the university proud for the work that you do. And so thank you for that. So we'll jump into some questions that our registrants submitted, if that's okay. And just kind of see what, as you can imagine, a number of the questions have been about vaccinations and, still trying to kind of figure out exactly, where we're going to be as a country in terms of that. But a number of them were asking, questions related to herd immunity, and whether that is something that you think is appropriate for us to try to achieve, and can we achieve it, and even I think if will it require that children be vaccinated as well if we're going to reach that level? If you could just talk about some of that.
Yeah, sure. So Steve, this term herd immunity, and for that matter, they are not, which we talked about a lot. These are kind of these obscure epidemiologic terms that have just gotten so much attention. And just simply to define it, herd immunity happens when enough people have protection or immunity against an infection, which makes spread unlikely. And the idea of the herd is that the entire community is protected, even if not everyone in the group is vaccinated or immune themselves. And the truth is herd immunity really only can happen with vaccination. It doesn't really happen. I can't think of an example of where it's happened with natural infection. And there was a lot of talk early on about this magic threshold, like 85%, 90%. And the truth is no one really knows. And from my standpoint, I'm less interested in the idea of we got to get to herd immunity to we need to get control of spread of COVID in the community. And the good news is that is happening in the United States. Not there's things around the world that are still very problematic, but even now, which we're at a little over 50%, 55% of adults across the US have had at least one of their doses of the 2-dose regimen. We're starting to see those numbers come down, including in our state of Michigan. So, I think there's some unknowns with this, exactly what that number is. And I hope, if it's not that the virus is completely gone, I hope we get to the point where it's in the rearview mirror and it's a nuisance and it's something that happens, but it doesn't shut us down. It doesn't overwhelm our health system.
Well, that we all hope for that. And, there still are people who are uncertain about whether it is safe to take the vaccine, and they're struggling with whether they're going to get it or not. Some people, for whatever reason. What kind of encouragement do you give to people about the vaccine? What is the best thing to say to someone that is still trying to decide?
The story, Steve, on vaccination, it looks better and better, both in terms of effectiveness and safety. And the truth is this is one of the safest vaccines we've ever seen. And we use that term hesitant, and most of the time, as you mentioned, it's really this lack of confidence in the vaccine, this concern about safety. But there are other issues around hesitancy, and I do think those are worth noting. Access has been an issue. It's not so much now because there's plenty of vaccine, but so for some people, just getting things scheduled, the technology can be a barrier. Transportation can be a barrier. And one thing that has come to my attention is that people are worried that they're going to get sick after they get the vaccine and they'll miss work and they won't be paid. And I think each of these issues has a little bit different approach. And again, there may be other reasons why people are hesitant. And the more we can do to address their concerns, the better. And again, the safety issues have gotten a lot of attention. And what I hear most from people is that they're concerned about how quickly the vaccine was made available and that this is an experimental vaccine. And of course, this is layered on top of misinformation and confusion, particularly in social media. And I try to break down each of those myths. First of all, the infrastructure to make the vaccine was there. It was there and waiting. And then every resource, and it was like the Manhattan Project. It was like Operation Warp Speed. Every resource went into making these vaccines. And because of the platform, they could be done really quickly. And, there's no evidence that the vaccines affect fetal development or fertility. But, these are difficult narratives to change, especially when there's so much amplification of the myths. And, again, I think some people, they just really don't want to be vaccinated.
Right.
And, it's a choice. But I hope for some people who are still trying to figure it out, who just maybe are nervous, they don't have confidence, that they get good information from a trusted messenger. And one of the best people for that is really talking to your own doctor, a healthcare provider that you know. And that's one of my recommendations. And again, just trying to break down some of the myths. The vaccines, for example, they don't integrate with your DNA. These are synthetic proteins that get in your body. It's like a recipe card that tells your body how to make the protective antibodies, and then it disintegrates. But again, I think we'll see where we are. The news on vaccines is getting better, and the CDC this month came out with more good news on this. And so my hope is that we're going to continue to see people move toward acceptance.
You mentioned that one of the best sources, maybe the best source to talk to about this is your own doctor. Are there other places that you send people to sort of not just about vaccination, but the whole? There are a lot of myths around the pandemic, and where are the places that you recommend people look to find trusted answers?
For me, the CDC website has been a trusted source. And, I will say that on our campus, both Michigan Medicine as well as the main campus, the Mason Blueprint site, we've tried to keep the FAQs up. And again, we use the CDC guidance, and we've tried to also have good information there and link to good information. And, your state health department also is a good source of information. But, the source is really important. And, there's some jokes circulating on social media, like, maybe your high school classmate that sells jewelry isn't the best source. That was was from one of the late night shows.
Yeah.
Not to say there's anything wrong with that, but it may not be your best source for vaccine information. And I think there's so much noise today, and that it's really hard to delineate. And for me, my own personal go-to source is the CDC website, and it is actually written in a way that's very consumer focused. So that's where I would recommend people go.
Thank you for that. So one last question about the vaccines, and I get about children. If you could just talk some about because that's the next wave that we have to get through. What would you say about that?
Yeah, so this is recently in the last couple of weeks, the 12 to 15-year-olds have now been moved into the group being vaccinated. And when we think back to the clinical trials last year to test these vaccines, the focus was on adults. And in fact, the focus was on older adults because they were the group that was most susceptible to severe illness and death. And, in fact, early on, we didn't think that kids even got sick at all. And of course, this isn't true. Children do get sick. Fortunately, they don't get sick that often. And they're a little bit less likely to spread to adults. But when enough of them get sick, they can have poor outcomes. So there are now studies that show in 12 to 15-year-olds that they can get vaccinated safely. And these are detailed studies, several thousand children. And again, this is on top of the now hundreds of millions of people who've been vaccinated in the 16 plus group. And just like any other vaccine, children, they can have some mild effects, a sore arm. These tend to be gone within a couple of days. And again, the previous issues I mentioned, the fertility issues, the changing your genetics, those are not issues in anyone, and they're not issues in children. But I do understand that people are going to be more concerned when it comes to their kids, and I get that. I get that as a parent, and I will also share that my own children are fully vaccinated, and my 12-year-old niece, who my brother's also a Michigan grad and an infectious disease physician, she was like the first in line to get vaccinated. So I think, again, from my standpoint, it's not just that I'm recommending this to someone else. This is a decision that my own family has made, and I think it was frankly an easy decision for us. But I will say that kids, they interact with their grandparents, their parents. They go to school, they play sports, they go on sleepovers, and so vaccination isn't just about keeping me safe because I'm vaccinated. It's about keeping everyone around me safe. And again, adults are the most likely to get sick and frankly to infect kids more than vice versa. But having the kids vaccinated offers another layer of protection. And particularly, things like Michigania, things like getting back to school, it's going to make it a lot easier to get there. And, finally, I would just say, this is a bit of a choice between accepting some unknowns, potentially, although we've had a lot of experience, but that risk needs to be balanced against the risk of getting COVID, which is a known risk.
That's a good way to put it.
Yeah.
So as we're heading into summer and, families are making decisions about how they're going to spend their summer, family vacations, children involved in summer camps or swimming pools and sports programs. What's your advice to parents about how to think about navigating through this summer?
Yeah, so I'm so happy, first of all, where we are this summer compared to last. And this is a question I answered many times last summer. My approach really throughout the pandemic has been to focus on what we can do and how we can do it as safely as possible, instead of just like what we can't do. And, frankly, if COVID is the only concern and that's all you worry about, then the answer is to stay home and never leave. But that's not an acceptable way to proceed at this point. Mm-hmm. And you can do things and still keep the risk low. And I think this is particularly a concern right now for parents with kids under 12 who are not yet eligible for vaccination. And what I say all the time, I say it on these Friday briefings, is COVID is not the only risk to your health. And for that matter, infection is not the only risk of COVID. And for kids, it's really essential that they get a chance to play, that they get the chance to interact with friends and family now that they can do that safely, and to stay physically active. And, this has been hard on us and all of us. But when you think about kids, you think about a 7-year-old, that 7-year-old might've been 5 when this started. And so I think getting back to things that feel normal are really important. And, the good news for the little kids is that the case numbers in the US are dropping, and they're dropping really fast. Mm-hmm. And so if everyone else in the family unit is vaccinated, that makes it a lot safer for the kids. And frankly, it makes it completely safe for them. So although you could make your risk zero by keeping your kid home, I don't think that that's really what I would recommend. I would look for ways to proceed. And the biggest thing is be outside. And this is what I've been saying to all people. Again, now that adults are vaccinated, we know that you can be indoors safely. It changes things a lot, but for our students, for example, all year long, I said, just keep your gatherings small and keep them outside. And I would say the same thing for families with children. And if everyone else is vaccinated, like grandparents, parents, the kids they don't need to mask indoors. So the issues become if you're at a big setting where you don't really know who's vaccinated, who's not, in those cases, keep wearing the mask. And, frankly, avoid those big gatherings if you don't really know who's there. And then, when it comes to summer camps and sports, this is where just asking some questions about, what are the plans, for example, at camps, what are they doing about testing? Are their staff vaccinated? And again, I think there are ways to create safety and create bubbles. And that trade-off is worthwhile because how much fun is summer camp, right? Like that is like one of the memories I have from childhood going to Girl Scout camp. And so, what I would say is avoid the riskier things, avoid sleepovers, piling everyone into someone's basement, play outside, keep the group small. If you need to, wear masks, but find ways to do things instead of just saying, I can't do this.
I really appreciate your candor in that. I think that's good advice and will be helpful to our parents. Earlier, when we were talking about the vaccinations and the challenges of people choosing to be vaccinated, you talked about some what I would call inequities that people face in terms of the ability to have access, and I think there are a lot of other ways in which this pandemic has revealed inequities in our health system and otherwise. I wonder if you could talk a little bit about that and what learnings you've had through this or things that you think we need to be aware of.
Yeah, so COVID has really highlighted all inequities, certainly in US society, but really around the world. And these are things that have existed, whether it's access to care, it's economic inequities, housing, employment. And when we think about the pandemic early on, it was essential workers got infected and many died. And this was before we really even understood the basic biology of SARS-CoV-2. We didn't understand the benefits of masks. And disproportionately, this was low-income communities, communities of color, people living in crowded housing, people working in agriculture, multi-generational households. And, something that maybe doesn't occur to people, but you might not have a place to isolate or even quarantine if you live in a one-bedroom apartment with, an entire family. And so these are inequities. And my hope is that the public health infrastructure that we have really put some resources into in the past year and a half can be leveraged to address some of the fundamental health issues, some of the reasons. And, again, that's like a whole separate discussion that maybe you could have with one of our poli-sci or policy people or someone like Luke Schaefer. But the truth is, in this country, we don't have a healthcare system. We have a sick care system. And health insurance, of course, is tied to employment. So I hope there are some good things. There are some silver linings that emerge to help us get at some of these inequities.
And I guess the key thing that you've said from me is that as a health expert, there's no question in your mind that those inequities exist, that they are
There's
real.
no question. Yeah, no question. And we're seeing them in vaccination. And again, some of the issues I mentioned where if you don't go to work, you don't get paid. So it means that employers maybe need to think about sick leave and saying, what, here's the incentive. You can have a half day of paid time off.
It will shift just a little bit on this topic to India. The University of Michigan has, I think now close to 1,000 students from India. We have about 7,000 alumni who are Indian or Indian American, and I just what's happened there, that as I understand it, has just sort of broken my heart. Now, I imagine you probably have some family there still, and I just wonder if it probably is very close to your heart. And I wonder if you might talk a little bit about that. And what do you think has happened there, and what lessons are there for us to learn?
Yeah, Steve, I really appreciate the question. And yes, even though I was born and raised in Michigan, I have a strong cultural connection to India. And my extended family, a lot of cousins, aunts, and uncles still live there, and including several who have gotten sick and hospitalized. My 97-year-old great uncle, my grandmother's last living sibling, was hospitalized, and amazingly like survived and came back home. And I had another aunt who did die a few weeks ago. So the situation in India is tragic, and it's a cautionary tale, and it's an illustration of just how much destruction the virus can create, particularly in crowded nation. If you've ever been there, it's just incredibly dense living, 1.4 billion people. And it's sort of unimaginable, like the scale of this, and the gap between what is needed and what is available is immense. And we saw in Italy, the health system overrun, and we worried about it here in the United States, and in a few communities that's happened. But imagining a whole country like that, and there's not one reason, and there's also not one reason to fix it, but it's the same issues, politics, misinformation, and they're really magnified. And we think about the weeks and months it's taken to get through waves of infection in this country. It's going to be like that there. And our most recent wave in Michigan, vaccination, is really what helped bring that into check. And that's still not available, at least on the scale that's needed. And so, and believe it or not, there's actually vaccine hesitancy there too, I've heard about. And even at a few million doses a day, it's going to take a few years to vaccinate India. And the thing is, and people might not know, is India was really positioned to help supply the world with its Serum Institute. And there are issues with raw materials, and there's issues with patents. And I think there is some progress with this, and aid is coming, and some of the vaccine patents are being changed. And there's help to try to speed up the vaccine, not just for India, but really for the whole world. And the story with India last year is that it was very, very successful, and the rates were low, and there were lots of theories like, oh, it's warm weather, it's immunity from other infections, but the economic fallout was really massive. And we'll see what happens there and what the appetite's going to be. I did see that the latest curves show there's some improvement. Good. But more than anything, this is an illustration of why the pandemic in the US will not end until it ends everywhere.
I appreciate you saying that. And I think also that this is a global problem, and we're all a part of that. Yeah. It's not the United States and the rest of the world. We're all together. And we, again, probably a good conversation for the political scientists to be involved in as we think about policy going forward. So if I take that question to the next level, and I'm going to read this next question from one of our participants, because I just thought it was stated so well. It's a big question, so prepare yourself. Here we go. If you were in charge of global vaccination scheduling, distribution, and logistics, essentially, you are given authority to decide who gets vaccines when, what would your thought process be for which country or area or population segment to vaccinate first? Given the current resource constraints and varying government responses, levels, or actions, how would your ideal approach compare to what might be considered the textbook global health or public health response? If you think about other times when we've had these, polio or whatever, can you think about a time when you can say, this is a good example of what we should do? But how would you approach it? You're now in charge of the world.
Yeah. I'm thankfully not in charge, because I think that's a big job. And the estimates are that we're going to need 11 billion shots to vaccinate the world, and we have about 1.7 billion or so right now. And as people know, most of this is in the U.S. and the European nations, Australia, and then it's a smattering in other places. But some of these places are very dense. And I mentioned the Serum Institute in India, and they have the ability to manufacture high quality, low cost vaccines. And what we're seeing is vaccine diplomacy with China, Russia, India, as well as the EU and US. But I guess what I would say, I'm going to answer this very complicated question easily, or in a simple way, is I would focus on getting healthcare workers vaccinated everywhere first, much like what we did in the US. If you remember, the phase 1 was healthcare workers and people living in nursing homes. And in the meantime, really working on logistics, the supply chain, the planning, the information, actually trying to also deal with misinformation, which can vary, and then coming up with plans. And around the world, they're not deep freezers, so you're talking about different kinds of vaccines, like the Johnson & Johnson, AstraZeneca vaccines. But this is it's funny, my son is studying industrial operations engineering, and he like thinks about logistics, and that this is an incredibly difficult job, but really at least getting the healthcare workers vaccinated first would be priority one. At least to keep your health system afloat. If your doctors and nurses and others are getting sick, taking care of patients, that's going to collapse the system very quickly.
All right. I think I'd put you in charge.
I
I have no authority to do
I
that.
think they're trying to do that. It's just, even that is
Yeah.
like going to trickle.
I'm just struck again, just I'd love to hear those numbers again. The number of vaccines that are needed worldwide, 11
billion is the number I saw.
Wow. And we're at 1.7 or something.
Yeah. And again, we're making vaccines. And some of these like AstraZeneca, the price I saw was like $4 a dose. So, but the raw materials aren't necessarily there, and it's not quick to make vaccines. A lot of this has been sped up, but it's and again, some of the supply from here is going to be donated, but it's such a small amount. 100 million doses is still just a tiny fraction of what's needed.
Well, we've been talking largely about the quest to stay physically well, but as you've been very, very effectively pointing out to our campus, May is Mental Health Month.
Yes.
And there's probably not been a May when it's more important to think about what that means than after over a year of a pandemic, right? I mean, I've seen the challenges that the anxiety and stress is causing on people of all ages. And I wonder if you could talk about it, generally, but then I think specifically too, I know a lot of people are really concerned about children and what, children and teen. And when I say children, I mean under 18 really, and how this pandemic is affecting them.
Yeah. And I said this earlier, and I'm going to say it again, it's just like, I say it every day. COVID is not the only risk to our health, and infection is not the only risk of COVID. And I've been very worried about social isolation and loneliness, which were already epidemic, believe it or not, on our campus. And, as things improve, there's going to be a lot of grief and loss that people are going to need to process. And I think, again, the issues are different for kids. They're different for adults. And we're seeing this, right? People are celebrating their second pandemic birthdays. And again, I think, at least in Michigan, things are improving a little bit right now. But as much as I have so much joy for the fact that the weather's beautiful, and we're starting to be able to gather. My heart does break for what's happening around the world. And if I would just say for kids, for a lot of them, it's hard to remember what it used to be like. Like I think even some of us have a little bit of trouble remembering what it used to be like. Parents, I would just say, first of all, you're doing a good job at something that's really hard. This is hard. And it's going to take time, but majority of kids are going to be okay. And I think understanding that and saying that is helpful. And, we're layering the pandemic on top of pre-existing mental health challenges, that have been there for many people. And this is hard. You add isolation, you add anxiety around getting COVID, and, the lack of making healthy relationships, and this again with our college population. We have students starting their second year next year who've never set foot in a classroom on campus. They don't really have a relationship with the campus, which is, kind of strange to think of. And again, we're talking the Alumni Association here. Right. So, the idea that you've never been in the Ugly or an Angel Hall, and that you're a second year. So, I think these are really difficult things. And I would also say that it's, there's just like this angst that surrounds all of us, political angst and angst economically. And, one of the things is just trying to think about ways to normalize things for the kids. And that's why I think summer camp and that is really good. And, letting them know, like, listen, things are going to get better. And again, kids are very resilient. And even the ones that are having a hard time with this, they can get better. And, for parents, like, reach out and get help, get professional help, your child's doctor, teachers, counselors, they are there to help you with this. And again, this is something that is beyond what any of us, when the school shut down last March, could you have imagined that a year later that kids are not back in school? And again, from on the campus side, some of our incoming students for the fall will have spent the last year and a half in virtual school. So I think that creates, and actually there are academic issues too, which feeds anxiety for people. So thinking about it, talking about it, and also saying, you know what, we've done a good job, and that this is really hard. I just want to say that.
Maybe I'll throw in a question that didn't come from our questioners, but I think probably a lot of people are wondering, for those who haven't heard, I wonder if you could just maybe, as you've been talking about back to school, what's it going to look like in the fall in Ann Arbor and Dearborn and Flint with the University of Michigan, and what, just generally kind of what can we expect? How much back to normal can we expect?
Well, one thing that I've been saying is that the fall of 2021 will look more like 2019 than 2020.
Okay, I like that.
Yeah, and is it going to look exactly like 2019? Probably not. But it's looking more and more like it'll look more typical. I would expect that we're going to have in-person sports, the big house. Will it be full? Unclear. I think some of those things are a little bit, it's hard to think months ahead because things change day to day with COVID. And I think if anything, things are going to improve and get better. We expect to have, students here in class. Really, it's not going to be the kind of hybrid year that was there. And a lot of that planning is going on right now. I think some of the unknowns are how many people need to be in a classroom. Some of the issues around like how many students are going to get vaccinated. And, our hope is, and our expectation is that number is going to be very high. And if that's the case, and these vaccines are as good as they look, and if the immunity lasts, which it should last at least, for several months and maybe a lot longer, COVID should be a side issue. And then we'll deal with all the other issues. So my hope is that it's going to look, it should look a lot more like 2019. Right now, this past year when you walked on campus, it seemed like a ghost town a lot of times. But there'll be still some issues around, reporting symptoms, and there'll be some testing, things like that. But my hope is too, by winter, some of that will improve as well. And, for our students joining us internationally, the issues will be a little bit different, and, we'll accommodate them. We'll figure it out. We'll make it work. But some of those details are still pending. And I think some of the fall plans, they'll be out very soon, some more details.
So one of the things I've taken from what you've said is and this fits my understanding, that, when you go through something like this, it's not like you do all the research at the beginning and then you just go implement everything. The research continues, right? I mean, so can you talk a little bit about how we're continuing to learn from the millions more vaccines than we were giving, and the way that people are reacting, and the way that as we move from one category of being together to another category of being together, we see different kinds of patterns. Just help those of us not involved in scientific research understand how that works.
Yeah, this has been extraordinary because things change so fast that even what we talk about in the morning, by the afternoon, sometimes it changes. And again, I think we've just kind of gotten used to that. One of the things I tell people is look at a timestamp on whatever you read, and make sure that everything we have has a timestamp, because you might say one thing one day and then it's like completely wrong the other. And again, as you said, Steve, the research doesn't end. And whether it's on vaccines, for example, duration of immunity, we don't know that yet. So far we have a group of people who continue to show good protection at 6-7 months. Is it going to be that way at a year? We're not sure. If it's not, we'll figure it out. We'll give boosters. will the variants come? If they do, we'll figure it out. So I think, you have to live with uncertainty, which is difficult. But again, the research continues, and across the Big Ten, one of the groups that I've done a lot with is in the Big Ten Athletic Conference, and helping advise Commissioner Warren on the return to play, which is really complicated. And even to think about it last year, this year we're like, yeah, we can do this, because we learned that transmission didn't happen in play. It happened in social settings. And now with vaccination, we can get back to things that look and feel more like normal. And so I think even between May and September, we're going to see a world of improvement.
Mm-hmm. Well, I hope you're right, and I believe you're right. I think the same thing. We're getting fairly close to the end of our hour here together, but I do want to ask a couple of other questions. One of them I'm going to kind of leave up to you to ask the question, but let me wrap up the questions that came in sort of in this way. Let's say, and I'm going to pick a number, and your first answer is probably going to be, well, in 3 years this is not going to be over. But let's say that we're 3 years down the road, and largely the pandemic is in the rearview mirror. And what is going to be our state of mind about, we're going to be looking over our shoulder to see when the next pandemic is coming. What are the things that we have learned or should have learned in this pandemic that will help us the next time there is a threat like this? I mean, just and what's going to be different? I mean, that we could spend an hour with you telling me all of that, but if you could kind of just talk about all of those kinds of things about what it's going to be like in the future.
Yeah, so I'm an optimist, and my hope is that we have learned a lot, and just from a pandemic preparedness standpoint, issues like not having enough personal protective equipment or having surveillance, those aren't going to be issues. I think that's stuff that will be an investment that will be here to stay. I think vaccine development, science, diagnostics, all that will continue. So I think we'll be better prepared for the next pandemic, whenever that happens. I hope it's not in my lifetime, but people say that there will be another one. What I think about too, though, is this notion of what we talked about last spring a lot, like we're all in this together, and people looking out for each other, their neighbors, and taking their friend's dog for a walk because their friend is a healthcare worker, and this idea of community. And I think about that a lot with our college community and our college campus. And I'm hoping that there can be some sense of community that maybe wasn't there, that people do understand that public health means what I do affects you, what you do affects me. Or it could be that people end up more divided than ever, and they can't agree on masks and vaccines, or even whether the pandemic is real, right? So, which brings me back to that need to have connections and conversations with people who are fundamentally different than you, have different experiences, and I hope 3 years from now we're more united than we have been.
I do too. And I think that'll help us in everything if we are.
Absolutely.
All right. The last question is yours. What have I not asked you that I should have asked you about this topic, or any other topic?
Any other topic at all?
Anything you want to talk about?
Yeah. I just, I think I hope we use this time. I'm not going to ask a question. I'm going to just say something, I guess, is that, there's just so much good we can do when we put our minds to it and we put resources together. I mean, the vaccines are what are going to get us out of this pandemic. And that happened because of science, because of logistics, because of healthcare workers, because of everyone. And you just think about the operation here at the big house and how many people that needed. And I really hope that this isn't the end of it, that we're like, okay, the pandemic's over, let's go back to normal, because normal wasn't so good in a lot of ways in terms of health. And, one of my interests, as much as I'm an infectious disease doctor and I always read about pandemics, I didn't really ever imagine that I would be in the midst of one like this. But, my hope is that we can figure out really how to improve health more broadly, even, on our campus, among our students, among our faculty, our staff, not just physical health, but emotional well-being, environmental, just the academic well-being, occupational well-being. So I hope that some of the connections we've leveraged, and again, when I just think about campus, the number of people that I work with every day on these remote meetings, some of whom I'm not even sure I've actually met them in person, but I feel like they are good friends of mine.
Mhm.
And even this conversation, Steve, like just
I know.
the fact that we can develop these relationships with people, I hope we can leverage them to continue, and to not just say, okay, we're done with the virus, so we're done, but like, okay, what can we really do that's bigger than that? If that makes sense. I'm kind of
It does
meandering.
make a lot of sense. I was just thinking the same thing about the connection that we feel even though we're not together. And I look forward to having a cup of coffee with you to talk about some of the political science pieces of this one day. But
Yeah, absolutely. I'll come to the Alumni Center, the new beautiful Alumni Center, and see you
it is.
soon.
That's what, in fact, that's what my background is. It's part of the newly renovated Alumni Center that we look forward to getting back in. This is one of the downfalls of the pandemic. We moved out in May of 2019 for the renovation, and we're supposed to move back in that fall. But of course, I'm sorry, 14 months later, we were going to move back in. And what happened is that the pandemic hit. And so we're not back in yet, but it's a beautiful building. We look forward to getting in it.
Yeah, and hopefully the students will get their bagels and all that
That's right.
stuff next year. So
We're already planning that. So that's
yes.
good. Well, Dr. Malani, I just want to tell you how grateful I am, for the time that you've given us here this evening, certainly. But I'm just really grateful for your leadership and what you're doing to make our university and frankly our world a healthier place. And I know that none of us knows everything, but I feel like that having people like you in places like yours, in positions like yours, are the thing. That's our hope. To be able, and I think our alumni certainly have learned a lot tonight. I can tell you, I trust you, and I appreciate the words that you've shared tonight. Has helped me a lot. So thank you for that.
And thank you for the kind words.
Yeah.
It's an honor, really, to have gone to Michigan and to continue to be able to serve the community.
Well, we'll keep letting you. Thanks so much. And thanks again to all of you alumni for joining us. It's been great to have you there and kind of observing from this virtual audience. And we look forward to a time when maybe we can have a session, Dr. Malani, when we're all together.
That's right.
With our alumni in person. Thanks so much. And we'll end like we always end. Go Blue.
Go Blue.